Hello, it's Claire OT and I'm still broadcasting from COT 2012. A lot of people are packing up now from the exhibition area, but the conference actually goes on for a little bit longer. And of course I wasn't able to get round and speak to everybody that I wanted to, and I'm sure there are lots of things that you wanted to see that I haven't managed to broadcast for you. One of the people that I didn't get to speak to and that I've managed to arrange to speak to now is a lady called Alison Austin, who's here representing the Department of Health. And Alison is working around the programme developing personal health budgets, and so I thought that might be an interesting thing to ask her about. So here's Alison. Excuse me turning the camera. Here's Alison. So hi Alison.
Hi.
I wanted to ask you, you're working around developing the personal health budgets programme, and I wanted to ask you how that actually works in practice for people. How do they find out if they can have a personal health budget?
At the moment we're piloting the programme, so there's various different approaches in different parts of the country, but essentially we believe that it be most suitable for people with complex health needs or people with joint health and social care needs. It's a way enabling people with long-term conditions, chronic needs, to be able to meet their needs in ways that's best for them. They may approach the person who they have most interaction with in the NHS, so it could be an OT or anybody in part of some of the big multidisciplinary teams. It could be GPs, it could be through their social work and then making the needs. What happens then is if the person's got a health need, it's agreed what the outcome's going to be, and then a budget is established so people know how much money they've got, and that enables them to plan better, so to decide how they're going to use that money, how they're going to meet their health outcomes. That can be using traditional NHS services, it can be getting services that are traditionally provided by the NHS by somebody else, or doing something completely different. So there's a care planning process that the individual can lead on with getting support from whoever that they want to get support from. So again, it could be OTs, it could be other health professionals, it could be peer support. We've got some peer support, user-led organisations, third sector organisations involved in helping people to think through the best way of meeting their needs. So a lot of people who have had